There is a very small proportion of chance that allergens can trigger eczema, but a majority of them would have either a genetic predisposition or just the way how the child's skin reacts to environmental factors. Hello, I'm Dr. Abraham. I'm a pediatrician working in Nottingham, and today I'm going to talk about eczema in children. What is eczema? It is also known as atopic dermatitis, which is a chronic inflammatory skin condition that can leave dry, itchy patches and red and swollen patches on the skin. The common areas that these can happen is the flexures of your arms or legs, the face, the hands, and the bends of your knees. What are the principal symptoms of eczema? The hallmark of eczema is essentially intense itching, and this can be quite debilitating, especially when they are infants and they struggle to scratch but would be having very unsettled periods of time. It can also lead to dry and scaly patches, and in severe cases can cause oozing and discharge, suggesting a possible secondary infection. What are the triggers for eczema in children? Eczema commonly occurs in children from anywhere from newborn to the adolescence. But the common triggers are extremes of weather, like in extreme winters or in the heat, the eczema can get worse. Woolen or synthetic materials, or soaps and detergents, or environmental factors, and sometimes pet dander can exacerbate your eczema. Other triggering factors for eczema, sometimes people wonder if there are certain foods that can cause eczema to flare up, especially around dairy, eggs, and nuts. There is a very small proportion of chance that allergens can trigger eczema, but a majority of them would have either a genetic predisposition or just the way how the child's skin reacts to environmental factors. That is very important to understand. Again, I would also like to add there are myths around the use of steroid use, but if it is used in the right strength, the right duration of the time, for the right flare-up, it does more good than harm. How can you manage your child's eczema? And it is extremely important here to understand that to alleviate the symptoms, you're not bringing a total cure for eczema. It is preventing and reducing the flare-ups that happen in children. What you can do is essentially identifying the potential triggers and ensuring that the child is regularly moisturized using gentle fragrance-free moisturizers and emollients can help reduce the dryness and the itching. Avoiding irritants and allergens by using non-soap products, and in a very small proportion of children sometimes you may use different corticosteroids and other medications to control the intense itching and inflammation of the eczema. Why is it important to seek medical advice? When the symptoms of eczema are quite intense, or if it is moderate to severe, then the children can scratch, and this can sometimes leave a portal of entry for secondary infection. And these can be potentially viral infections or also bacterial infections, which can sometimes lead to more significant and serious problems. It is then, and even before, if you seek medical advice, to get on top of the eczema, as we know there is no cure for it, but you want to reduce the flare-up and bring the eczema level to as much as it can be controlled. And also identifying the triggers for eczema, especially with your child, knowing your child if woolen clothes can trigger it or synthetic detergents can trigger. This will allow your child to enjoy a happy and healthy skin.